Welcome to the DNX podcast. My name is Sylvia Crispin. I am your host, and I'm here today with Harry Adelson, and he practices stem cell medicine in Park City, Utah for the treatment of pain. Hi, welcome.
Thank you so much. Yes.
I'm so excited that you can make the time today to speak with me. I just watched you on stage earlier today, and you just had the most interesting presentation.
Well, thank you very much. Thank you very much.
Yeah, it was really, really informative. And I think what struck me the most was your comment on how to treat haters.
Yes.
Yeah. Because I think if you are not putting yourself out far enough, you're not going to have any haters. But if you do, like you are, you're going to experience some negative feedback. However, tell us a little bit more about your practice.
So I practice the regenerative medicine for the treatment of chronic pain. So I started out doing something called Prolotherapy, which is the injection of natural substances that are simultaneously nutritive and slightly irritating into a damaged musculoskeletal structure to trick the body into thinking that it's been re-injured, thereby launching the body's natural healing cascade. That evolved to the use of platelet-rich plasma, which is using platelets from your own blood, which are the very thing responsible for triggering your body's natural healing response. That then morphed into using stem cells from your own body, bone marrow, and fat for the treatment of pain.
That's incredible. How did you get started in this? Like, why did you want to go in this direction?
When I was in my first year of naturopathic medical school, I had a shoulder injury, and I spoke to a surgeon, and he said, well, I can put a scope in your shoulder and I can remove that piece of torn cartilage, and it's probably going to help in the short term, but it's going to cause you problems later in life. Now, I was planning a climbing trip to France, the birthplace of modern sport climbing, 2 months later, and I was completely unwilling to take no for an answer.
Yeah, I know that feeling.
And I said, that's right. And I said, here I am, I'm young, I'm healthy. I just can't believe that there isn't a way to kickstart your body into hyper healing.
Yeah.
I was treated with regenerative injection therapy, prolotherapy, resulted in a complete cure, and that was it. My life unfolded before me.
That's fascinating. So you just said earlier you studied naturopathy, and what made you choose that over medicine?
Well, in the United States, naturopathy is slightly different than in Europe. In Europe, naturopathy exists. In the United States, it actually is a doctoral degree. So it's a 4-year degree that includes pre-med, and then you go through a 4-year program, and I did a hospital residency. It's a small profession. We do have the authority to prescribe drugs. We can do minor surgical procedures, including stem cell procedures. But I was attracted to it because I'm fascinated with the philosophy of using the body's natural healing response.
That's fascinating. I didn't know that was a degree in the United States, because it is in Germany as well. And I think a lot of people in this audience are from Germany as well. It's
yeah, the original naturopaths are from Germany, and the American naturopaths who started the profession of naturopathy in the United States learned it in Germany, brought it back to the U.S., and then sort of modernized it.
Got it. Really interesting. I did not know that. I have to actually. Now you told me something I didn't know. Yeah. So, what fascinates you the most today about your field of medicine?
Well, I think probably just the limitless possibilities. Low back pain is the leading cause of disability worldwide. The global economic impact of low back pain is greater than cancer and heart disease combined. The conventional treatment of pain is dismal. There really is, very little that can be done. On the one side of the chasm, there's sort of drugs and there's steroid injections, which are not terribly effective. And then you take this gigantic leap across a huge canyon to surgery, which carries tremendous risk. Stem cell therapy is very safe and extremely effective.
Right. When you say safe, what does that mean to you?
Not causing harm. There's very little harm involved. There's a minimally small risk of infection. I've treated 10,000 people with stem cell medicine. I've had one infection, so 1 out of 10,000. Yeah. Beyond that, the biggest risk is that it's not going to help.
Right. which is not a real risk. It's just, it didn't work.
That's right.
it. Yeah. That would be a disappointment, not a risk.
Precisely.
Yeah. Interesting. So why do you think it has such a bad rap? You know, like why is there negativity? Why are you exposed to negativity in this field or from audiences?
Well, there's the medicine is a massive multi-trillion-dollar industry that is a machine and is an organism. And organisms are their most core instinct is self-preservation. And stem cell medicine really flies in the face of that.
Right.
It really does not go along with any of the of how this machine works. We're using stem cells from your own body, so there's nothing that can be patented. There's nothing that can be put in a bottle. There's no big money to be made for any major corporation.
Very true.
So it's subversive.
Yeah, it's true. But you are able to practice seamlessly in the United States.
Yeah.
Yeah.
Oh, yeah. You bet.
So lower back pain is the biggest problems that you're treating?
Low back pain and neck pain, that's mostly what I do. We treat a lot of arthritis as well.
Yeah. Arthritis, how interesting. Tell me more about that. Why arthritis?
Well, most low back pain, neck pain, arthritis, any sort of chronic pain syndrome is generally a degenerative process. It's either from a single traumatic injury that doesn't completely heal or chronic overuse, so overuse injuries. So this is just wear and tear of connective tissue, usually on the microscopic level. So if you were to do a biopsy of, say, an arthritic joint, you would see that there's all these fissures and the nerve endings are being exposed and irregular blood vessels, and this is just unhappy connective tissue.
So if I wanted to get started with stem cell treatments, and I would say I have joint pain or like maybe a shoulder issue. For example, I have a frozen shoulder quite often. I have I don't have full range of motion in my shoulder. Where would you tell someone to start? You can't just go to anyone that does that. What's the best and safest way to research a practitioner like yourself? Because not everybody can make it to Park City.
Sure. Well, are we talking about the United States or are we talking about Europe?
Well, both. But is there a starting point to find good information?
I belong to a network called the Cell Surgical Network. The website is Stem Cell Revolution.
Okay.
And stemcellrevolution.com, and that lists doctors who are members of this network, who are, I think, doing it appropriately. That we're all functioning under an IRB. We're all actually recording our outcomes and doing research.
Explain a little bit more what an IRB is.
An IRB is an institutional review board. So what that means is that the studies are written out formally, submitted to an institutional review board, which is sanctioned by the United States government, Department of Human Health Services, and the research methodology has been validated as ethical and safe.
Wonderful, that's amazing. What is the most interesting case that you've had, that you've worked on?
Oh gosh, they sort of blend together. They sort of bleed together because I would say, I love treating conditions of the spine because, for instance, I love treating desiccated disc, dehydrated discs, because that's something that occurs frequently in young people. It happens frequently to young, healthy, athletic people. It happens a lot of times just from like deadlifting with poor form or doing some form of exercise with poor form. And you get a slight little fissure in the disc, and the moisture leaks out of it. It's extremely painful, and there's no conventional treatment. I mean, nothing. The only conventional treatment is narcotic pain medication. The only conventional treatment is fusion, but no surgeon will consider doing a fusion on a 23-year-old, for instance, because if you have a fusion at 23 years old, you're gonna have to fuse additional levels every 5 years, because once you fuse one level, the levels above it and below it take the additional stress and they wear out very quickly. That's where stem cell medicine really shines. We take stem cells from the bone marrow, we take stem cells from the fat, we inject it directly into the intervertebral disc, and really, I mean, it's staggering. I've been doing it for 8 years, and I still, to this day, sometimes have difficulty believing people when I talk to people how much better they're doing.
Wow, that's fascinating. So somebody told me the other day I should consider stem cell freezing at my age, because I might not need it now, but I might need it later. Do you recommend that?
Well, I'm a bit on the fence, because I think it's worth doing, and I think that I think there's no harm in doing it. I think that the advances that are being made now very likely are going to make it obsolete, because what we're doing now is isolating exosomes. What exosomes are is you take placental stem cells, which are the most robust of all mesenchymal stem cells, which are the most useful of the stem cells. You take these placental stem cells, you place them in a first of all, you culture expand them, so now you have hundreds of millions of them. You place them in a stressful culture medium, so they actually think that their host is under duress.
Right.
And they sprout these vesicles filled with growth factors, which are in fact the active ingredient of stem cells. And then the stem cells themselves are destroyed, and just the exosomes are harvested, just the active ingredient. So now you're getting all the benefit of the stem cells without the genetic material from the other person. And my guess is, and this hasn't played out in research yet because there hasn't been enough research done, but my guess is we're going to find out that those are just as valuable as culture expanding your own stem cells as a young person. I think it's worth doing. The answer is yes, I think it's worth doing, but my guess is in probably 5 years or less, we're going to realize it's not necessary.
Interesting. What excites you the most when you think about the future, like what's going to happen in the next 5 years when it comes to stem cell?
You know, I'm really sort of just focused on today at this point. Yeah, I think it's evolving so quickly. It's very difficult to know where it's going. My personal passion is making it affordable. So my goal is to try to take this wonderful treatment, which currently is very expensive, and bringing it within the realm of affordability. The way I want to do that is strip away all unnecessary pretense and make it just, only keep those things as they have to do with safety and efficacy, and bring the cost, the normal cost to about 30% the industry value, the current industry standard.
So currently it is not covered by health insurance?
It is not, and I don't believe it will be at any point soon.
Why is that?
It doesn't fit into the system. It just does not fit into this behemoth of a system that we have. I remember, when I spoke at the Bulletproof conference, I did a little experiment. I said, okay, so if you had a little bit of knee pain and say, it wasn't really bad enough that it prevented you from doing most things, but say you just couldn't play tennis at the level that you're quite accustomed to, and it was just starting to become a problem. If you knew that insurance would pay for it, how many people would rush out this year and get a knee replacement? And not a single hand in the place went up.
Right.
And then I said, okay, so same question. If getting a little bit of knee pain and it was just starting to bother you, and you knew that insurance would cover it, how many people would rush out and get stem cell medicine this year? And every hand in the place went up.
Right.
Yeah, I think that what would happen is people would line up around the block. It would be very difficult to control, and it just isn't profitable enough for hospitals, for these these systems that are in place.
That's unfortunate. So just to have an idea, what does it cost now? If you say that you want to bring down the cost to about 30% of what it is now, what does that mean?
The normal industry standard for a single joint is usually $8,000 or $9,000.
For one joint?
Yeah. For a low back treatment, it's around $10,000-$12,000.
Single treatment?
Yeah. Fortunately, it requires very few treatments. Normally, you do a treatment in a year. You might do a second treatment, and then usually people are good for years.
Right. Okay. Interesting.
So yeah, it is expensive.
Yeah, it is expensive. But then
but
again,
so is being in pain.
Yeah.
Being in pain is expensive.
If you totaled up a decade of pain medicine and treatments and yoga and acupuncture and whatever else is available, you probably end up at that same number.
That's right.
Yeah. Very interesting. Thank you so much for being here.
You're most welcome.
Appreciate
Thank
it. I know
you.
that you needed to make some time for this, so we appreciate this. What we'll do is we will put the notes below the podcast so people can find you and reach out to you. Where would they reach out to if they wanted to?
My website is docereclinics.com. DOCERE clinics.com.
Wonderful. Thank you so much.
Thank you.
Thank you so much for tuning in and listening. I hope you enjoyed it. Before I leave you, I want to invite you into my world. Join us at the DNX Festival in September in Lisbon. If you go to our website and use the promo code podcast50, you get an extra 50 euros off your ticket. And subscribe to this channel and leave us a review if you can. We will review these frequently, and you can leave us a question that we will answer live online. Until next time.